You're listening to Health Radio. Talk radio. Just for the health of it. This is Health Radio. Time now for Ask Dr. DeSilva. Here's Dr. Derek DeSilva.
Hello, folks. Once again, great to have you back with me. Thank you for joining me. Here with you Monday through Friday, by the way, from noon until 1, where we get to talk with you about your health. You know, we've talked a little bit about skin cancer, and May is Melanoma Month and Skin Cancer Detection and Prevention Month. And once again, joining us is Dr. Monica Halem. She is a dermatologic surgeon practicing in New York City at Columbia Eastside. She specializes in skin cancer surgery, laser, and cosmetic surgery. Dr. Halem, welcome to the program.
Great, Dr. Silva. Thank you.
So you're a dermatologic surgeon. What's the difference between a dermatologist and what you do?
So we actually do an extra couple years of training. Once we do finish our dermatology residency, we go on and specialize in more of the surgical approach to skin problems such as skin cancer, laser surgery, and cosmetic surgery. So we're dermatologists, but we actually go on and do an extra year or two of training.
Now, talk to me about this whole idea of melanoma and your role. So somebody's been diagnosed with melanoma, they have the biopsy done, they have the area removed. Where do you go? How do you get involved from there?
So the dermatologist is usually the one that does the biopsy. Somebody's diagnosed with melanoma, and they're sent over to me to do a standard surgical excision. Now, depending on the depth of the melanoma, you follow certain protocols as far as how much you need to excise. Once that's excised, and it's just done with standard surgical excision.
And excise means taken out.
Right.
Okay.
A surgical excision or taken out with surgery. And then you, depending on the depth of the melanoma, you can go on to have different procedures. Some people need to go on and have what's called a lymph node dissection, where you actually take out some lymph nodes under the arm or wherever it might be where they drain from. But it all depends initially on the first excision, or when you take it out, and how deep the melanoma is.
Uh-huh. And let's switch gears a little bit to plastic surgery. I mean, do you not do not plastic surgery, cosmetic surgery?
Right.
You do that also.
I do. So a lot of times when we take out the skin cancer, you have to close the skin, and that's where the plastic surgery comes in. So we are trained actually in plastic surgery on how to do closures of the skin to make it look cosmetically appealing. Mm-hmm. So that's the one part of it. And then in addition, we also do cosmetic surgery where, you're on a more cosmetic level as opposed to a skin cancer surgery. What
is the most common cosmetic procedure that you do?
Probably Botox,
botulinum
toxin, very common. Young patients, older patients, it's actually one of the greatest things that we have available to us. We've been doing it now for about 20 years, and there's absolutely been very few side effects when it's used for a cosmetic use. And it's interesting how they found it was originally used to treat migraines, and the doctor who was treating the migraines found that the person had their wrinkles disappear. Mm-hmm. So it was actually a medical indication and was transferred over to become a cosmetic indication.
Besides Botox, I mean, my feeling, and I've worked in aesthetics. I have worked in, I have not done any aesthetics, and a lot of the stuff that I do are the ingestibles and things like that. Mm-hmm. But, one of my biggest fears, and people have tried to get me to do both. I'm a primary care physician. I'm an internist.
Okay.
I think, my opinion, I think that if somebody's going to have Botox, somebody's going to have Restylane, they're going to have fillers, you're going to have any of these procedures, I really think that they should be going to people like you, not people like me.
Well, I happen to agree with you because we actually do specialty training in this. And I always like to tell my patients, I can teach anybody to pick up a laser and shoot it or to inject something. But you really need the specialty training and the understanding of the anatomy and the understanding of the skin to treat patients appropriately and to limit the amount of side effects that you'll get. Mm-hmm. So yeah. I'm in concert with you as far as, you really do need that specialty training.
And I feel very strongly about that. We've like I said, we've switched gears a little bit, but if you're going to do a procedure, most general surgeons can probably do heart surgery, but would you want a general surgeon doing heart surgery? No.
Exactly.
You want to go to somebody who's trained, who knows what they're doing. And I think this is a very, very important issue that you folks need to be aware of. These Botox parties where somebody comes in and injects some stuff, this is where the dangers are.
Right.
This is where the problems begin. What about lasers? Can you tell us a little bit about them?
So the same thing with laser surgery. We see a lot of primary care physicians, OBGYNs, other physicians who aren't specialized in laser training actually doing these lasers. And the problem is that I see the complications. I can teach anybody to pick up a laser and turn the switch on and shoot it, but it's really understanding the settings of the laser and how the laser impacts the skin and what target you're doing. You really need a specialty training in order to understand and minimize your complications.
Tell us about lasers. What are they used for? Where would you do it? What's the purpose?
So there's a couple of things that we use lasers for. We use lasers for brown spots on the skin. We use lasers for red spots on the skin, so little blood vessels that you have, little broken blood vessels that you have after sun. We use it for wrinkles. We use it for tightening. So those are pretty much the broad areas that we're using laser for these days.
And when you use things like lasers, every state has different regulations as to who can do the procedure.
Right.
Some states, just physicians. Some states, you can have a physician present. What are your thoughts on that?
So I'm a big believer in doing the lasers myself. I feel like it's my duty to my patient in order for me to do it. Again, it's easy to turn a laser machine on. It's easy to shoot the laser, but it's not easy to really understand. And my problem is I see the complications. I see the burns. I see the dyspigmentation or the funny skin color after somebody's been burned from laser. So I'm a big proponent of having the doctor do all their laser treatments.
Mm-hmm. And I'll tell you what, folks, if your skin's a little bit darker and you are going to see somebody that's doing a laser, you better make sure that they have treated dark-skinned people before. Right. And this is you're not the first person that they're doing, because that is a huge issue, and I've seen some major disasters with that. Comment on that?
Right, I agree with you, Dr. Silva. Again, it requires that specialty training. We see a lot of these spas and laser centers that are set up, and it's really, there's no doctor there, or there's a doctor off-site, and it's a nurse or, medical assistant doing these lasers, and I see so many complications and so many burns from this, and it's a real problem. And people go there because they want to save money. Mm-hmm. But really, you end up with a much bigger risk. So I recommend you go to a dermatologist, somebody who's trained in laser, who's spent a year or 2 years learning about that laser. Okay.
What about ingestibles, antioxidants, fish oils? Any thoughts on them?
So I think those are very important. I think both topically and orally. I'm a big proponent of topical vitamin C. I think that's a great antioxidant. Ferulic acid, another great antioxidant. So I think that there's a lot of research going on in this because it's really a whole preventative type of medicine, but I think both orally and topically are where we need to go.
Have you ever used CoQ10 topically?
I have, and in fact, I did a couple studies where I did my training, and we actually did show that it did decrease some antioxidants. Mm-hmm. I mean, some oxidation.
Right. I have been using CoQ10 on my skin for the past easily 10 years. It's almost a pure form of CoQ10 that has some vitamin E, alpha-lipoic acid, and I'm 52 years of age, and I'll tell you what, it has made a huge difference in the way my skin looks. But, skin is genetic, too. The big part of skin is genetic, is it not?
A big part is genetic, but it's also an environmental. So one of the biggest things, in addition to antioxidants, that you need is a sunscreen. Mm-hmm. And I recommend that my patients wear sunscreen every day, at least SPF 30 or higher, and that you wear it on a sunny day, on a cloudy day, on a rainy day, whether you're going to be outside, you're going to be inside. The ultraviolet radiation comes through our windows, it comes through the clouds, so you can't really just bank on just because it's sunny you want to put on sunscreen. Mm-hmm. The sun is the number one cause of skin cancer and the number one cause of premature aging. So both, if you want to prevent cancer and you want your skin looking great, you need to wear sunscreen SPF 30 or higher every day.
Folks, I'll tell you the best way to start looking like an old bag. One of the best ways to start looking like an old bag is to smoke and go out into the sun.
Right.
Guaranteed in a year you will look like you've aged about 10 years. Yes or no, Doctor?
I couldn't agree more. I can tell when my patients come in that they're a smoker without them even telling me.
Absolutely. All you have to do is look at them and look at their skin.
Right.
Hey, thank you very much for joining us.
Oh, you're welcome.
I really appreciate the time. Thank you very much for taking the time to spend some time with us today. Once again, folks, get more information. They have a good website, dermatology.columbia.edu. Once again, dermatology.columbia.edu. I thank you very much for joining me. Don't forget that I am here with you Monday through Friday from noon until 1 as we speak about your health. If you'd like to email me anytime, drd@healthradio.net. And don't forget to come back again next time. Thank you very much for joining me. God bless you all. Have a great day. And may you always be blessed with good health.